The coronavirus was first reported about, Scotty, it seemed children were not being affected by it, but now at least 7 states are reporting cases of a mysterious illness in kids now, believed to be related to COVID-19. And as NBC News reports, it now has an official name. It's called pediatric multi-system inflammatory syndrome. It's a long word. And to discuss this is Dr. Salil Pradhan. He's with the pediatric department at Valleywise Health Medical Center. Good morning to you.
Good morning.
Could you tell me more about this mysterious illness? You say it's connected to COVID-19 with children. So we are listening to this one.
Sure. So unfortunately, before this all started, we were thinking the kids weren't quite as affected by COVID-19 as adults were, which was a good thing. But New York started reporting some cases of this multi-system inflammatory syndrome over the past few weeks, and then other states have reported it as well. So it seems to be sort of a COVID-related. It's different from the other symptoms that COVID-19 is causing. It seems to be specific to a certain degree to kids, but it's something new that we're seeing with them.
And what are the symptoms?
So at this point, while the early symptoms may be similar to other COVID-19 symptoms as far as runny nose and coughs and colds, it seems that they're presenting more with a much more inflammatory case, so what we call shock, where the body isn't perfusing the organs as well as it should with blood and oxygen. They're having some other findings as far as heart disease, which is similar to some other inflammatory syndromes we have. So it's more of an inflammation in the organs and in the blood vessels that we're seeing.
So our kids at home, when we start seeing them, is it coughing? Is it respiratory? How will we notice? I mean, because it sounds more internal for the doctors, and that's what you guys are seeing. But for a mom or dad, when should we be alarmed and take our kids to the doctors?
I think anytime a kid presents with, just not acting the same as far as activities, certainly as far as not eating and drinking appropriately, just seems really just run down. If you feel like the kid's just not as active and acting themselves, it's a good idea to at least call the physician's office at this point. We still are recommending calling ahead to the doctor's office rather than just coming to the doctor's office, just to make sure that the office itself is prepared to see your child. So certainly a phone call to the doctor if you notice, more than the usual cough, cold, low fevers kind of stuff. If they really are not behaving themselves, seem to be sicker than usual, to go ahead and call the doctor.
And is it unlike coronavirus where you can actually prescribe the children something to make the symptoms ease up, or is this something you have to sit through like coronavirus?
No, if it's really progressing to the multi-system inflammatory syndrome that they're seeing, that requires hospitalization. So certainly if a parent is worried that their kid is progressing to this disease process, a phone call to the doctor's office or a visit to the emergency department is warranted at that point, because it does require hospitalization.
So, Doctor,
or at
what
least
do
an
you think
evaluation.
this means in terms of our kids going back to school in the fall? Because, I mean, obviously they've been out for months now, so we're approaching the next school year. What does this mean now that you guys are seeing this in children?
I think it means we'd have to keep a close eye on the numbers that we're going to see over the summertime. I think it means that we're going to have to be vigilant for what's coming. It's hard to predict what's going to be happening in the fall. It's hard to predict whether we're going to have other measures in place. And so it's hard to say that. Certainly, I think we just need to keep a closer eye on it at this point. It's been very few cases, or not a very large number of cases. And so it's hard to make any ideas of what's causing it, what the treatment is, what works best. We really don't know much about it because we haven't seen too many cases yet.
Yeah, so just stay aware, keep a close eye on your kids as far as symptoms and how they're acting. We got it. Dr. Pradhan, thank you so much from Valleywise Hospital.